I'm Nick Ferran. I'm a consultant trauma and orthopaedic surgeon specialising in shoulder and elbow surgery. I'm passionate about delivering awake shoulder and elbow surgery under regional anaesthesia where appropriate, and have interests in treating conditions such as frozen shoulder, rotator cuff tears, fractures and dislocations around the clavicle, shoulder and elbow, and nerve problems such as cubital tunnel syndrome and carpal tunnel syndrome. If you have any of these problems or want a consultation about your shoulder or elbow, please get in touch with our practice management team. Tennis elbow is a common condition patients often ask me about. It usually is signified by pain on the outside of the elbow, which has a gradual onset and usually is not due to trauma or injury. Tennis elbow can sometimes be referred to as tendinitis or tendinopathy. The proper name is lateral epicondylitis. And although this term suggests that inflammation is the problem, we now know that it's not. Tennis elbow is a degenerate condition that occurs in one of the tendons that attaches onto the outside of the elbow. There are many ways to treat this, and certainly in the early phases, painkillers, including anti-inflammatories and over-the-counter splints, would allow patients to self-treat and manage their symptoms. In more severe cases, the first step would be physiotherapy, and seeing a physiotherapist for a 3-month course of exercises to strengthen the tendons and stretch them usually relieves the symptoms. And we can often reassure patients that their symptoms should improve within a year. In the past, we quite commonly treated tennis elbow with steroid injections, but most recent evidence has shown that steroid injections are bad for tennis elbow and can make patients worse off than if they weren't treated at all. So I try to recommend to my patients not to have steroid injections for your tennis elbow, as this produces some short-term goals in terms of improved pain, but in the long run the pain can come back and often be worse off than before the injection. If patients don't respond to conservative management such as painkillers, splinting or physiotherapy, then I recommend keyhole surgery to take away or debride the damaged degenerate tendon. And this often can relieve symptoms and have patients back to normal activity within about 3 months. If you think you have tennis elbow, get in touch with our practice manager and book an appointment for a consultation, and we can work out a treatment plan that's right for you. Tennis elbow is a degenerate condition involving one of the tendons on the outside of the elbow, which can cause significant pain. It usually affects patients who have either repetitive jobs or certain sporting activities, including tennis, which put repetitive strain on the tendon. Because this is a degenerative process, it can't be cured. But it's usually self-limiting in that the pain gets better on its own, usually within a year. And there are lots of treatments that patients can have to try to help with their symptoms. The most obvious one is activity modification, and that is avoiding the activities that cause the pain. They can try painkillers to help control the pain, and often where they can purchase over-the-counter tennis elbow splints, but these must be worn properly, and I'd recommend that patients follow the advice leaflet that's provided so that they're worn in the correct position and only during activity. Physiotherapy, however, has been proven to improve symptoms of tennis elbow, and that's usually the first line of treatment, so that most patients can avoid surgical intervention. But if you do need surgery, I often recommend keyhole surgery to debride the damaged tendon and that often gets patients back to activity within 3 months.